Good morning. So today I want to address a very important topic. This is more relevant than ever before because ever since Robert F. Kennedy became the Secretary of Health and Human Services, we have seen a dramatic decline in immunization rate. And this is secondary to vaccine hesitancy from the parents. I think when the head of the Health and Human Services is casting doubt on the safety profile of vaccine, and keep in mind these are vaccines been given for decades, then it's only natural to expect parents to have doubts themselves about giving their children vaccines. And unfortunately, pediatricians are not really trained to communicate the importance of vaccination to parents during medical school or even during their medical training in pediatric residency. Communication skills is something that we do emphasize as new doctors, but exactly how to do it and how to perfect this art, and even having the relevant factual information on how to convey this information, is often lacking. I've come across so many times very experienced and well-meaning pediatricians really struggle in failing to convey the importance of hepatitis B vaccination right at birth. And they simply don't know the idea and the history and the ramification behind this practice. And it's truly unfortunate because these are good pediatricians. They just don't have the tools or the training. And why should you listen to me, you might ask? Well, maybe it helps that, I've been a pediatrician for nearly 27 years. I got my medical degree in 1999. And maybe it also helps that I've written a book on vaccines in 2010. And maybe it also helps that I consistently win the Patient Parents Communication Award in both practice at Kaiser Permanente and Memorial Care for years on end. Pretty much every year I win this award. Not necessarily because I'm a better doctor, but I think because I'm a better communicator. And maybe it's because I'm a better communicator since I do run a YouTube channel for the last nearly 20 years. And I have a YouTube channel dedicated to ADHD and communication with parents. So this is what I'll tackle today. That's the preface. So ever since 1991, the United States has recommended all newborns to receive the hepatitis B vaccines within 48 hours after birth. And this has been going on for decades. But I think the reasoning behind this practice has not been effectively communicated to all practicing pediatricians. And this is truly unfortunate. I don't know even how why it happened. Maybe because we do have incompetent leaders and politicians. If you have leaders like Robert F. Kennedy, who are in charge of the Health and Human Services, of course, this lack of communication is to be expected. But I'm hoping that I can make a small dent in this failed process. So prior to 1991, what were we facing here? Well, first of all, let me address the fact that hepatitis B is an infection caused by a virus. This virus is transmitted in two different ways. One is from having sex, the other one is from blood-borne infections. So in the real world setting, how do some of the people get hepatitis B? So you can get hepatitis B from having sex, of course, and having a blood transfusion on the blood product that's tainted with hepatitis B virus. That's another way. Another way is sharing needles when you're an IV drug abuser. That's another way. Well, if you stop there, then naturally a well-reasoning and meaning parent would say that, well, why should my newborn be getting this vaccine? because my newborn, I hope, is not having sex yet. My newborn is not doing IV drugs because, well, we're not giving him or her the IV drugs paraphernalia to abuse heroin. And he or she hasn't needed any blood transfusions. So why are we even doing this, right? Well, the most common way for people to get hepatitis B infection in the world, worldwide, is that they get it from their mother during birth. Because a lot of, especially in Asia, a lot of mothers have hepatitis B infections. Either they got it from their own mother, or they got it during sex. And they basically pass this infection on to their newborn babies right at birth. It's like a curse that gives and keeps on giving, because if the baby is a girl, then most likely she will be infected and she will pass on this deadly infection to all of her children too. So what's the chances? What happens when the mother passes to the hepatitis B infection to the baby right at birth? Well, there's 90% chance that the infection is going to become chronic and cause liver failure, because a newborn's immune system is very weak and cannot contain the infection. So if a newborn baby gets the infection from the mother at birth, there's 90% chance that the infection is going to become chronic. It's going to cause something called cirrhosis, which is basically liver failure, scarring the liver. And what happens with cirrhosis, not only does your liver fail, but with cirrhosis and chronic hepatitis, there's 40% chance that the chronic infection, because this smoldering infection is going to generate inflammatory cells to become activated in your liver for a long period of time, 40% chance that you're going to get liver cancer. And believe me, I worked at and I practiced at UCLA Medical Center, where we're a major liver transplant center. Liver cancer is deadly, and it's probably one of the worst ways to go. When you have liver cancer, your liver fail, and not only does it metastasize to other parts of your body, liver failure is an ugly way to die, because it basically interferes with your ability to clot your blood. So it also causes pressure to back up into the veins in your esophagus. So these patients often form a very dangerous complication called esophageal varices. And I have seen little girls die from this. Basically, they cannot clot their blood, and they also have these engorged veins in their esophagus. And once these engorged veins rupture, they will spew blood from their body like one of those fountains at the park, except it's not waters and pigeons. It's just blood squirting out from the blood. I've seen girls that way, and I would never forget that. So why are we doing this? In 1991, prior to the implementation of this universal vaccination program, more than 200,000 babies each year in the United States get hepatitis B infection from their mother. 200,000. And of course, as we know, it doesn't stop there, because if they are baby girls, then they will end up passing this infection to all of their children as well. So it's a multi-generational curse. So what happened after we implemented the vaccination schedule in 1991? In one year, the number of cases of hepatitis B, congenital hepatitis B infection from the maternal transmission to their baby, dropped from over 200,000 to less than 200. So that's the difference that we made. And the reason we don't talk about this, because we're not having an epidemic crisis of hepatitis B infection. And people don't realize what's not happening. The vaccine is so successful that it's a victim of its own success. Having all these adults who are healthy, who are not dying from liver cancer, is the end result of this program. And now people are questioning this because they're not seeing dead babies or dead adults. It's truly unfortunate. But I hope this video in this talk can enlighten you and you can pass this message on to other people. Thank you. Bye-bye.